Are you curious about the uses of hydralazine? In this video, we will explore the primary conditions that hydralazine is commonly used to treat, dosage recommendations, potential side effects, and user testimonials. Hydralazine, a medication with vasodilator properties, is prescribed for a variety of medical conditions. It is often used to treat high blood pressure, especially in individuals who cannot tolerate other antihypertensive medications. Additionally, it may be recommended for managing congestive heart failure, particularly in combination with other heart medications. When it comes to dosage recommendations, the appropriate amount of hydralazine will vary depending on the individual's medical condition, age, and weight. It is essential to consult with a healthcare professional for accurate dosing instructions. Like any medication, hydralazine may have potential side effects. These can include headaches, dizziness, flushing, and a rapid heartbeat. It is crucial to be aware of these possibilities and to report any adverse effects to your healthcare provider promptly. To gain a better understanding of hydralazine's effectiveness, we will also include user testimonials. Real-life experiences can provide valuable insights and help individuals make informed decisions about their treatment options. Whether you're considering hydralazine for your health needs or simply seeking information, this video is a comprehensive resource to help you make informed decisions about its use. Read on to learn more. What is hydralazine? Hydralazine is a medication with vasodilator properties that is commonly prescribed for the treatment of various medical conditions. It works by relaxing the muscles in the blood vessels, allowing them to widen and improve blood flow. This video will delve into the primary conditions that hydralazine is used to treat, dosage recommendations, potential side effects, and user testimonials to provide you with a comprehensive understanding of this medication. Primary conditions treated with hydralazine. Hydralazine is primarily used for two main medical conditions: high blood pressure and congestive heart failure. High blood pressure, also known as hypertension, is a common condition that affects millions of people worldwide. It occurs when the force of blood against the walls of the arteries is consistently too high, putting strain on the heart and blood vessels. For individuals who cannot tolerate other antihypertensive medications or who have resistant hypertension, hydralazine can be a suitable alternative. It is particularly effective in cases where hypertension is caused by renal disease or other factors that affect the kidney's ability to regulate blood pressure. Hydralazine works by relaxing the blood vessels, which helps lower blood pressure and reduce strain on the heart. In addition to high blood pressure, hydralazine may also be prescribed for managing congestive heart failure, CHF. CHF is a condition where the heart is unable to pump enough blood to meet the body's needs. Hydralazine is often used in combination with other heart medications, such as beta blockers and diuretics, to improve heart function and relieve symptoms like shortness of breath and fatigue. Dosage recommendations for hydralazine. The appropriate dosage of hydralazine will vary depending on the individual's medical condition, age, and weight. It is crucial to consult with a healthcare professional for accurate dosing instructions. Typically, hydralazine is taken orally in tablet form, and the dosage may be adjusted over time to achieve the desired blood pressure control or heart function improvement. For the treatment of high blood pressure, the initial recommended dose of hydralazine is usually around 10 to 25 milligrams taken orally 4 times a day. This dosage may be increased gradually to a maximum of 200 to 300 milligrams per day, divided into multiple doses. It is essential to follow the healthcare provider's instructions and not to exceed the prescribed dosage. When used for congestive heart failure, the dosage of hydralazine is usually lower than that for hypertension. It is typically started at 10 to 25 milligrams taken orally 3 times a day and may be increased up to 75 milligrams 3 or 4 times a day. Again, it is crucial to work closely with a healthcare professional to determine the appropriate dosage for your specific needs. Potential side effects of hydralazine. As with any medication, hydralazine may have potential side effects. Most side effects are mild and go away on their own, but some may require medical attention. Common side effects of hydralazine include headaches, dizziness, flushing, and a rapid heartbeat. These side effects are often transient and diminish in intensity with continued use of the medication. In some cases, hydralazine may cause more serious side effects that warrant immediate medical attention. These can include chest pain, shortness of breath, swelling of the feet or ankles, and a persistent cough. If you experience any of these symptoms, it is essential to seek medical help promptly. It is important to note that hydralazine may cause a condition called drug-induced lupus erythematosus, DILE, which is characterized by symptoms similar to systemic lupus erythematosus, SLE. Delay is a rare side effect, but it is crucial to be aware of the possibility. If you develop a rash, joint pain, or other symptoms suggestive of lupus, it is essential to inform your healthcare provider. User testimonials on the effectiveness of hydralazine. Real-life experiences can provide valuable insights into the effectiveness of hydralazine. User testimonials can help individuals make informed decisions about their treatment options and understand the benefits and potential drawbacks of taking hydralazine. Many users have reported positive experiences with hydralazine, noting that it effectively lowers their blood pressure and helps manage their heart condition. Some users have mentioned that hydralazine has been a lifesaver for them, allowing them to live a more active and fulfilling life. They have reported improved energy levels, reduced symptoms of heart failure, and an overall improvement in their quality of life. However, it is important to acknowledge that not all users may have the same positive experience. Some individuals may find that hydralazine is not as effective for them or that they experience side effects that outweigh the benefits. It is crucial to remember that everyone's response to medication can vary, and what works for one person may not work for another. If you are considering hydralazine for your health needs, it is essential to have a thorough discussion with your healthcare provider. They can provide personalized advice based on your specific medical condition, history, and other factors that may influence the suitability of hydralazine for you. Alternative treatments to hydralazine. While hydralazine can be an effective medication for managing high blood pressure and congestive heart failure, it is not the only treatment option available. There are several alternative treatments that your healthcare provider may consider based on your individual needs and circumstances. For high blood pressure, lifestyle modifications such as a healthy diet, regular exercise, and weight management are often recommended as the first line of treatment. In some cases, other antihypertensive medications, such as angiotensin-converting enzyme (ACE) inhibitors, angiotensin II receptor blockers (ARBs), or calcium channel blockers, may be more suitable. Similarly, for congestive heart failure, lifestyle changes like a low-sodium diet, regular physical activity, and weight management are important components of treatment. In addition to hydralazine, other medications such as diuretics, beta blockers, and ACE inhibitors may be prescribed to manage the condition effectively. The choice of treatment will depend on various factors, including the severity of your condition, any underlying medical conditions, and your individual response to different medications. Your healthcare provider will work closely with you to determine the most appropriate treatment plan. Precautions and contraindications for hydralazine use. Before starting hydralazine, it is crucial to inform your healthcare provider about any existing medical conditions, allergies, or medications you are currently taking. Certain conditions and medications may interact with hydralazine or increase the risk of side effects. Hydralazine is contraindicated in individuals with a known hypersensitivity to the medication or those with coronary artery disease. It should also be used with caution in individuals with kidney or liver disease, a history of systemic lupus erythematosus, SLE, or low blood pressure. If you are pregnant or planning to become pregnant, it is important to discuss the potential risks and benefits of hydralazine with your healthcare provider. Hydralazine is generally considered safe to use during pregnancy, but it should only be used if the potential benefits outweigh the potential risks to the fetus. It is also important to note that hydralazine can interact with certain medications, including other antihypertensive drugs, nitrates, and erectile dysfunction medications. These interactions can increase the risk of low blood pressure or other adverse effects. Therefore, it is crucial to inform your healthcare provider about all medications you are taking to ensure safe and effective use of hydralazine. Hydralazine interactions with other medications. Hydralazine has the potential to interact with several medications, including those used to treat high blood pressure, erectile dysfunction, and heart conditions. It is important to be aware of these potential interactions and to consult with your healthcare provider before starting hydralazine or making any changes to your current medication regimen. When combined with other antihypertensive medications, hydralazine can enhance the blood pressure lowering effects, leading to a significant drop in blood pressure. This can increase the risk of dizziness, lightheadedness, and fainting. Therefore, it is crucial to monitor blood pressure closely and adjust the dosages of these medications accordingly. Hydralazine should not be used concomitantly with nitrates, as the combination can lead to a potentially dangerous drop in blood pressure. Nitrates are commonly used to treat angina, a condition characterized by chest pain or discomfort caused by reduced blood flow to the heart. If you are taking nitrates, it is important to inform your healthcare provider before starting hydralazine. Certain erectile dysfunction medications, such as sildenafil, Viagra, tadalafil, Cialis, and vardenafil, Levitra, can also interact with hydralazine. These medications can enhance the blood pressure-lowering effects of hydralazine, leading to a significant drop in blood pressure. If you are taking any of these medications, it is important to discuss the potential risks and benefits with your healthcare provider. Monitoring and follow-up while taking hydralazine. When taking hydralazine, regular monitoring and follow-up with your healthcare provider are essential. This allows them to assess the effectiveness of the medication, adjust the dosage if necessary, and monitor for any potential side effects or interactions. During follow-up visits, your healthcare provider may check your blood pressure, heart rate, and other relevant parameters to ensure that hydralazine is effectively managing your condition. They may also order blood tests to monitor your kidney and liver function, as well as your blood cell counts, to ensure the medication is not causing any adverse effects. It is important to attend all scheduled follow-up appointments and to communicate any concerns or changes in your health to your healthcare provider. Open and honest communication is key to optimizing your treatment plan and ensuring that hydralazine is the right medication for you. Conclusion: is hydralazine the right treatment option for you? Hydralazine is a medication with vasodilator properties that is commonly used to treat high blood pressure and congestive heart failure. It can be an effective treatment option, particularly for individuals who cannot tolerate other antihypertensive medications or who have resistant hypertension. When considering hydralazine as a treatment option, it is important to have a thorough discussion with your healthcare provider. They can assess your individual needs, medical history, and other factors to determine whether hydralazine is the right medication for you. It is also crucial to be aware of the potential side effects and interactions of hydralazine. While most side effects are mild and go away on their own, some may require medical attention. It is important to promptly report any adverse effects to your healthcare provider. Ultimately, the decision to use hydralazine should be based on a comprehensive evaluation of your individual needs and circumstances. By working closely with your healthcare provider, you can determine the most appropriate treatment plan that will effectively manage your medical condition and improve your overall well-being.